Welcome to the Infection Prevention and Control Champion team. Infection Prevention and Control, also known as IPAC, is a functional approach used within congregate living settings to keep all individuals safe and healthy. It refers to evidence-based practices and procedures that, when applied consistently, can prevent or reduce the risk of transmission of various microorganisms in these and other healthcare settings. Today's presentation is the first of the Becoming an IPAC Champion series and will be presented to you by the Thunder Bay District Health Unit IPAC Hub team. The IPAC Champion series modules were originally presented live to our facilities, but have been adapted for these recordings. To start, we have some objectives for this series. Upon completion of Module 1, you will gain an understanding of a CLS IPAC champion and how this role fits into your facility. We will discuss how appointing an IPAC champion can directly benefit your organization. You will learn the roles, responsibilities, and expectations of the CLS IPAC champion. And lastly, we will discuss where to find resources to support you in your role and the ongoing IPAC support available within the community. We keep using the word champions, but what are IPAC champions? IPAC champions are individuals who are dedicated to improving infection control practices by influencing and eliciting positive change within their workplace. By being role models for best practices, designated champions will take personal responsibility and hold others accountable as part of your facility's internal responsibility system. Who are IPAC champions? Champions can be self-identified or nominated for the role by colleagues or their employer, by showing interest in the role, or portraying the qualities of a champion at work. Champion qualities include being a respected individual, having IPAC knowledge, having enthusiasm for the topic at hand, being team-oriented, being open to new ideas, being a great listener, and using strong, effective communication. When a champion has these qualities, they are able to lead CLS infection prevention initiatives by engaging and educating colleagues, solving problems, and communicating across all levels of leadership.
Being an IPAC champion means that you are trained, well-versed in basic IPAC practices, and confident in your abilities. If you don't feel you are there yet, familiarize yourself with the best practices document, your facilities policies, or reach out to us and we will ensure you get to the level where you feel confident in your IPAC practices. Let's take a look at a few more additional skills and traits that are important for an IPAC champion to have. As we discussed, an IPAC champion must be able to lead the change necessary for improving IPAC practices within the setting, while being effective advocators and communicators. And they must be able to model best practice behavior and observe others in doing so to help facilitate change in practice. Now that we've looked at the who and what, let's discuss the reasons why IPAC champions are so important. IPAC champions support the implementation of best practices within your organization in order to prevent the spread of infection in a post-pandemic world. Remember, IPAC isn't just for COVID. It is for all communicable diseases and outbreaks. IPAC champions support the vision of the organization, encourage and motivate others, and they're important for helping to move new ideas or innovations through the stages of initiation, development, and all the way to implementation. Throughout the pandemic, we learned to adapt to a lot of innovative thinking and sought new ways to approach old ideas. Champions are open to new learning, techniques, and adapting to situations. They are the voice between the employees and employers to ensure the implementation works on paper and in practice. Champions will promote and maintain a culture in which infection prevention and control is of the highest importance and at the forefront of your organization. If all facilities had champions in place prior to the pandemic, things likely would have started out smoother and transitions would have been easier. However, we cannot focus on what could have been. Instead, we should put that energy towards the future and reducing the risk of outbreaks or preparing for the next pandemic. Now let's discuss the roles and responsibilities of the IPAC champion. The champion is responsible for monitoring, supporting, and educating staff, visitors, and contract workers regarding IPAC measures and best practices through auditing and promoting good IPAC habits. The champion is also responsible for assisting the facility IPAC lead and collaborating with occupational health and safety by reviewing and providing input into facility IPAC policies and procedures. This individual would be most up to date on IPAC best practices, as well as able to assist with updating basic IPAC policies and procedures to ensure the facility is updating these based on the most current practices. The IPAC champion also ensures supplies are accessible and plentifully available at each point of care area. They also are tasked with providing coaching around proper hand hygiene and personal protective equipment techniques to protect the client and the staff member from any infectious diseases. The champion is also a resource for staff IPAC inquiries or concerns.
IPAC champions are appointed as a contact person to communicate with the public health unit and to build external capacity with other community stakeholders. This ensures a smooth transfer of important information from the public health unit to the congregate living staff members, as well as learning opportunities to be gained. The IPAC champion can ensure that policies and procedures are updated and remain up to date when new guidance emerges from the Ministry of Health, or best practice documents are updated, or when any scientific evidence may suggest a better option for their facility. With the champion being a liaison for the information, they can ensure any relevant information is provided to the right individuals to initiate a change within their facility. Additionally, individual congregate living settings have unique challenges. This can be addressed through collaboration between the public health unit and the IPAC champion. As we know, each facility can be very unique and quite different from one another. IPAC is not always a black and white topic, and problems can be solved with innovation. The IPAC champion is able to discuss and facilitate these changes at both the management and employee level. Champions can converse with management about any potential changes and what works in practice, but may also be the lead to help initiate these changes with their colleagues. As you can hear, champions are the middle person or the glue between the facilities and the Ministry of Health. Here's a visual to demonstrate that IPAC champion being that main point of contact. So again, as an IPAC champion, you are the point of contact for new or updated information or guidance for your facility, your first point of contact or backup for management, as well as that liaison with the IPAC Hub for information, questions, and support. Questions from colleagues that you may not know the answer to can be directed to the Hub, as well as you can be the voice to request any further information or when requesting more education on a particular topic. Champions are the voice between management and staff in a safe, non disciplinary, education based manner. Staff may bring you information or questions that you in turn bring forward to management, and vice versa. A champion can be the liaison between the frontline staff and the employer. This allows two-way communication and allows for IPAC change and progress. Being that middle person allows for dissemination of information from management to the frontline staff. This achieves everyone having that common goal to constantly work towards a better standard, benefiting both staff and the clients you serve as a facility as a whole. Auditing. Another role of an IPAC champion is assisting with internal auditing of IPAC practices. This can include routine auditing as well as auditing during outbreaks. Infection control audit tools are key in assessing and evaluating current infection control practices within your setting. For example, hand hygiene, personal protective equipment, and environmental cleaning. There are tools created by Public Health Ontario that you can use within your own congregate living settings. You can use this QR code provided on the slide to access some of Public Health Ontario's personal protective equipment auditing tools. If you need to, you can pause the slide now in order to access that on your phone. A standardized approach to the audit always allows for benchmarking of practices across the setting, therefore enhances standards of care within the facility. Results of audits can identify barriers and gaps within your organization. Audits also provide in the moment feedback to staff members in a non disciplinary way. Again, our focus is education. This helps us to achieve immediate and long term improvements. Now that we know more about what the IPAC champion is responsible for, let's discuss how this directly benefits your facility. As we are already aware, IPAC champions can continually promote best practices and identify where the gaps in knowledge within the facility to enhance quality of care. Another benefit is educating and engaging staff through peer coaching, which is an important intervention to prevent the spread of infections. When speaking with staff members and doing peer education and auditing, further barriers can be identified at the level of frontline staff. Barriers and gaps can be communicated by the IPAC champion across all levels of leadership to address in a timely manner. Being an IPAC resource. The IPAC Champion is an in-person resource for staff members who have questions or concerns about IPAC practices. Since champions receive the information from the public health unit and management, they would likely be the individuals with the most up-to-date information and full picture within the facility. And with the champion typically being a colleague, they're also accessible for any staff members in a timely manner. Another benefit with a champion is that they can advocate for change. The IPAC champion is an advocate for following best practices within your facility. This can increase the quality of care provided and decrease the transmission of infections to clients. What works on paper doesn't always work in practice. Being able to advocate from both levels, staff and upper management, allows for full understanding of both approaches and more successful advocacy for change. Through working with occupational health and safety to optimize protection for employees, champions may assist occupational health with maybe vaccine or illness-related exclusion education from the IPAC perspective. A different educational approach and understanding may allow for less transmission of infectious diseases within your facility. As a champion, you may have an opportunity to learn new skills and increase your knowledge, which in turn allows you to share with all staff members, ensuring everyone benefits from this greater knowledge and understanding as a whole. This also allows for greater transparency and trust within your team and amongst your staff members, as they can understand the rationale behind these measures. This helps to achieve greater willingness to utilize IPAC practices during their daily job tasks. For example, why do we take off PPE in this order versus differently? Understanding why we do it or why it is important provides knowledge to staff and increases compliance, worker safety, client safety, and worker morale.
IPAC champions create a better workplace environment. As a champion, you demonstrate commitment to infection prevention and control by continually promoting IPAC best practices within your workplace. Of the many things that COVID has taught us, one of the most important is that we need to be better prepared. IPAC has been placed on the back burner for too long and must continue to be a larger priority within congregate settings, hence the reason for the implementation of IPAC hubs. We know from experience that the faster the IPAC response, the less time homes will spend in outbreak, which ultimately will allow for better client health outcomes. IPAC practices can help to decrease the spread of disease, decrease death of clients, and help to increase staff retention by making staff feel more comfortable providing direct care to clients. Next, we are going to review the 4 steps organizations were asked to follow when starting the process of identifying IPAC champions within their workplace. The first step is already completed, while the last 3 steps are ongoing and continue to ensure your success within this role. Step 1 was to identify potential champions within your organization. This is you. You've been chosen by your organization to take the lead and become their IPAC champion. You have all the qualities as well as knowledge of the basic principles of infection control that are required for this role. With this, you can work with your colleagues to improve infection control practices within your setting. You will advocate and promote the change needed within your workplace and will be instrumental in ensuring those changes are implemented and sustained long term. Step 2 is the training. Today is the start of your training, and here at the IPAC Hub, we are here to support you as you navigate this new role. We are hoping to meet with you over the next few sessions to ensure your IPAC training continues and to help you get a sense of what you need from us as you spend time as an IPAC champion. Step 3 is to empower. Your organization will work with you to further understand your role, set goals, and timelines moving forward. Your workplace will be constantly asking you for your input, ideas, insights into IPAC as you talk to staff and observe current IPAC practices on a daily basis. The key is to keep open communication with all staff as you navigate your new role. The final step is to sustain. We want you to succeed, as does your organization, so we are all here to support and guide you. We want to first recognize your work and efforts thus far. We want to continue your hard work, and we are invested in your success. We encourage you to attend and participate in infection prevention and control classes, seminars, workshops, and other continuing education opportunities to keep you current in IPAC best practice. Things are constantly changing in the world of IPAC. You are the key to ensuring IPAC stays in the forefront as you continue to build and sustain IPAC capacity within your workplace. As an exercise to get you started, we hope that you can identify an IPAC policy or procedure that already exists within your facility. The important policies and procedures to review include hand hygiene. What is your facility's policy for clinical and non-clinical staff? Are there any policies on auditing and compliance? PPE. What is the available information regarding staff donning and doffing PPE? Are there any resources available to supplement this policy? And environmental cleaning within your workplace. What dictates housekeeping staff's environmental cleaning practices within your facility? Once you have identified what policies your facility has for each area we mentioned, you want to find out, where are these policies and procedures located? Who has access to these policies and procedures, and how are they accessed? Are your policies and procedures available online or in printed form only? Is each policy procedure current and up to date? Do they follow the most current best practices? Are any of these aforementioned policies and procedures missing? This activity will help familiarize yourself with your facility's IPAC policies and procedures, how they read to employees, and help you identify a starting point to making change and building knowledge as your facility's IPAC champion. The goals for the Champions program is to have an up-to-date list of all of our facility champions to connect you with other individuals around the community in this supporting role. Please reach out to the IPAC Hub with any change in contact information or if you are leaving your organization so we can reach out to your successor. We strive to keep strong relationships with all of our partners and be an easily accessible resource. Keeping this list up to date will allow us to provide updates, resources, invitations, and important information in a timely manner. Sharing this list among champions allows for networking so you can reach out for support among peers. Our other main goal is to create a champion community by holding regular meetings. During these champion sessions, we will provide education and help each other problem solve using each other's expertise. We also hope to facilitate discussions, provide tools, and ensure that you are supported by us and that you are successfully providing IPAC within your facility. The Champion Series was presented in a way to divide the information and apply it slowly rather than presenting too much information all at once. This allows for a smooth introduction and transition into roles without overwhelming the champion or facility. To help you out further as you become an IPAC champion, we have identified several IPAC resources out there that are available to you. The first one is us, the IPAC Hub here at the TBDHU. Our partners have the opportunity to utilize connections made within this community of practice. Our community of practice is a bi-monthly meeting of all of our IPAC leads within our congregate facilities. It's a meeting place to share IPAC information, knowledge, and resources, and a safe place to seek out assistance with unique situations and learn from one another. Recall that sharing resources is key for your IPAC champion. We have many available on our TBDHU website, including PPE training videos and posters, signage for around your facility. The IPAC Hub can support you in all of your IPAC practices, activities, and initiatives within your organization. We can provide you with education, site visits, guest presentations, and can help partner you with other organizations to further support you in your champion role. In addition to our local resources available, we wanted to highlight 2 other places to get started. IPAC Canada is a national organization, and their goal is to advance infection prevention and control by advocating for their members and providing access to evidence-based resources, education, and networking opportunities. They provide a yearly national conference, offer and link participants to IPAC courses, provide webinars, and access to tools such as auditing tools. Public Health Ontario is a provincially funded organization that provides IPAC guidance based on scientific evidence and literature. They are a fantastic resource with many videos, infographics, and guidance documents to support all things IPAC in Ontario. Thank you for viewing our first presentation on IPAC Champions. As always, we welcome any questions you may have at ipachub@tbdhu.com.